Okay, first you need to, I guess, determine whether that athlete is ready to do some contact drills, but assuming they're symptom-free and progressing well, then the next logical step is to introduce them. But some things that you can probably do in just a small space in a clinic setting, or obviously if you're working with a team, you can do some of these activities with the athlete if you're physically able, or bring in another athlete to help you with that kind of contact drills and assessment. So Michaela here is our patient. So what we're going to do first is do some bumping with Brooke here. So getting down in that athletic stance, bumping, yep, good, and swap sides, go on to the left, good, excellent, rest there. That's all feeling fine, yep. The next one you're going to do is when I say go, you're going to get down into that kind of bumping position. You're going to try and push each other out, and then on my second go, you're going to try and go for the ball, yep. Go. That's it, push her out, Go. Good. So we're going to progressively do a little bit more contact now, and what are we assessing for as well is probably important with these activities. So first of all, it's the physical capacity of the player to do it. It's also their confidence and anxiety around getting into some contact as well. As I take you through a few more, it's going to be bringing in different kind of rolls and head swiveling. So we're testing a little bit of that vestibular capacity as well. And any kind of obviously symptoms or apprehension around the activity. So the next one we're going to do is front-on contact. So you're going to face each other. So this mimics very Australian football specific, but the tackling. So again, you can use the athlete as your coach a little bit if you're not familiar with the sport in terms of what activities they might need to do. So here we're going to step right foot in, and then you're tackling shoulder on shoulder, and you're getting your chin to back. So just get into that position to begin with. Yep, good. All right, so then what you're going to do is just actually swap left and right. So keep nice and light on your feet, and then you're going into that tackling position. Yep. All right, so swapping right and left a little bit quicker. Good. And then as you get more confident, really kind of driving in that shoulder. Good. Excellent. And hold there. Good. So what we're going to go through now is just rolling. So in a lot of sports where there's contact, you have to know how to kind of fall to the ground and take contact with the ground. So it's not just contact with another player like we're doing before, it's also contact with the ground. And we know a lot of concussions, especially in Australian football, actually don't happen from a head contact. They actually happen from a whiplash mechanism. So the ability to actually go to ground is really important, and to be able to control the head as you kind of roll back as well. And I think particularly for women and girls, just because of society and developing those skills as a young girl, wrestling, rolling around in the ground, then they're kind of key skills that aren't necessarily developed and might need a little bit more work as well. So to begin with, you can actually just start them on their knees, and what you're going to do is roll back onto your shoulder in a diagonal angle. So just pretending like you're tackling someone in front, and then you're going to drop your hips, and then you're going to actually roll back onto your back shoulder. Yeah, you might want to go, you go that way. Yep, so pretending you're in that tackling motion and you're rolling, yep, back onto your shoulder, and then you're bouncing straight back up. Yep, just do a couple, and we'll do a few coaching points. Yep, good. That's it. Excellent. All right, hold it there. So the girls are doing it really well in terms of controlling their neck on the way down. So it's almost like a bit of dynamic neck strengthening at the same time. So as you go down, you don't want to let the head roll back. You're kind of tucking the chin up and making them kind of bounce back up again. You're actually getting a bit of core and neck strength kind of by rolling backwards and forwards. So I would actually dosage this up as do 10 to the right, 10 to the left. And if you do kind of 20 of these in a row, it's actually a bit of a hard workout, and you might actually feel like you've done a bit of a core workout the next day. Yeah. Say for like basketball, actually like kind of taking a charge as well. So think about it for your particular sport, how it might work. So taking a charge, you're actually probably going more that direct backwards as well, which is a bit hard to do from the knees, but we'll practice it from standing. So up on your feet, you're going to do exactly the same thing. Again, just make sure you've got enough space around you, but pretending like you're tackling someone, and you're going to drop again, go into like a squat position almost, and then the same thing, you're going to roll back onto your shoulder and controlling that head. Yep, good. Excellent. Yep, good. Couple more. Yep. All right, now I want you to go like kind of, yeah, you're taking the charge in basketball, and you're just going to go straight back again, control that head. Yep. Yep, play for it. Yep, good. Excellent. So by doing those like different directions, again, we're kind of, testing that vestibular system a little bit, rolling around. We're now going to do some more forward rolls. So if we just get one of you to demonstrate this one. Again, we might go knees to begin with. So if they're lacking a little bit of confidence to kind of actually get into this activity, or if they just haven't done it much before, starting on the knees, and you're going to go right hand in the air, and you're going to brush your hands on the ground, and you're going to kind of go into like a bit of a like turtle shell. That's another kind of good teaching cue as well with the rolling, is to actually kind of think that you're kind of tucking yourself in like in a turtle, and you're going to tuck your head under, and you're going to do like a forward roll over your right shoulder. I'm not going to demonstrate and embarrass myself. Yep, good. Yep, maybe start over here so you've got plenty of room. Yep, good. Yep. Do a couple more. Yep. Excellent. Yeah, and you almost end up on the opposite hip as you go over. Yeah. Do a couple more. Yeah. Excellent. Michaela, do you want to come in and do a couple as well, and we'll just see how you go with it and what's going to be the best in the, yep. Yep. Good. All right, do you want to try that from standing now?
Yep.
Yep, good. Yep. So the key here is teaching points. Don't put the arm out, because we're going to get broken arms. And yeah, rolling, tucking in. So it's not that common of action to kind of do like that in isolation in a game, but if you kind of get pushed, or your momentum takes you, being able to kind of forward roll. But those backwards ones are probably more relevant in terms of the tackling action. Last one is we're going to get you with the ball. You're going to just like throw the ball up to yourself and just grabbing it like this, and I'm going to be walking around you, giving you a little bit of a whack with a few different objects. So what I want you to do is, if you kind of are sensing that I'm there, I want you to be like on the swivel, swiveling your head, and almost like fending off if you see the contact happening. All right, off you go. So just touching. Good. 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 Yeah. So again, that's just bringing in, again, a bit of the head swivel, cognitive load as well with the task, and yeah, a bit of ball skills and stuff as well. So, okay, so that's just a basic assessment that you can hopefully do in your clinic setting, or if you're working with a team, just to see their physical capacity, if they've got any symptoms with that, if they've got any confidence issues around doing those tasks, and the different rolling, head swiveling activities bring in the vestibular system, and also like a bit of dual tasking with the skill stuff as well. So that's probably really enough. It's very basic to kind of get a gauge on whether they're ready to go into some more competitive contact drills, and working with the athlete and potentially their coach or high performance team if you're working in that setting, to then design some drills, which we're going to show you now. They may also have some questions around helmet use as well is quite a common one. Should they wear a helmet when they go back to contact? And if there's any kind of anxiety from parents and stuff as well. Again, speaking from an Australian football setting, there's no kind of evidence to suggest that helmets reduce the risk of concussion. When I say helmets, the kind of soft padded headgear, there is some evidence that they can reduce skull fractures and lacerations and things, but it's not necessarily going to prevent a future concussion. And I think working on some of the physical capacity, making sure they're getting a graded loading, and working through some of maybe the technique risk factors is probably most important to hopefully prevent those second injuries. And I think, again, that's where you as a health professional can have a role.